But do you think that they'll help, like, in the future, like, kind of prevent worse concussions? Because, I mean, they were just saying, like, it was going to help, like, return to play and all that type of stuff. But that sounds like what you guys are doing.
Well, the one issue around concussion, both diagnosis, treatment, return to play, is unlike other things in medicine where they have kind of guidelines, more concrete guidelines. So if you have 3 of these symptoms, you can the studies will show that if you do this lab test, 80% of the time it'll really help. There's really not a lot of that's called evidence-based medicine. There's not a lot of evidence-based studies with concussions for a few reasons, but amongst them is that each one is so individual. Okay, and we every athlete that we get concussed, they have a little bit of a different presentation, a little bit of a different story. I think that the guidelines, I think their intent is to serve kind of as guidelines. To really somebody that says, I don't have a lot of experience with concussions, where do I look? Well, you look at that. Okay. We don't do anything, especially around concussions, probably the same way twice because we pattern that. Yeah. I recently did a talk at the health center here about concussions as it relates, and one of the other physicians here talked about she's an emergency room medicine physician, about what we should look at when the student who's not an athlete comes in with a concussion. Right. And I said one of the advantages that we have, especially if I take care of the football team, is I get to know those guys pretty good over their time here. I get to know their personality. I get to know their cognitive strengths and weaknesses. So I have a really good idea if a guy is not acting appropriately. Yeah. Now, and that's where maybe I don't know the cross-country team as well, but their trainers do. And that if their trainer says she's not acting right, then I know that. And that's one of the disadvantages of like somebody who doesn't see a lot of concussions. So I think the guidelines will, in terms of your question as to what might prevent more serious concussions, that opens up a whole can of worms for discussion. Yeah. Football is a violent sport, and you don't have to, you can watch on television, but you stand on the sidelines or you stand at practice and you actually hear that collision like standing right next to you, and it's like somebody hitting a car. Yeah. And so, do you change the rules? They changed the kickoff rule. They've changed other rules about getting flagged for penalties and hitting up high and leading with the head. And I think the intent is very good, and I'd like to see that would potentially help, but it's going to take more than a concussion guideline. It's going to take maybe a change of the sport, and that's where, football fans loved seeing the collisions.
Yeah, well, it's like NASCAR too. They just
right. That's exactly right.